It wasn't really a surprise move considering his anti-vaccine rhetoric and history of advocacy. This is something that experts were concerned about before his confirmation once he was nominated for the position officially. But it's the speed at which everything happened that's what took me by surprise.
Welcome to Deep Dive. Here at the Washington Examiner, we dig deep into what's happening behind the scenes in the nation's capital. And this week we have someone who's in the trenches to give us clear insight. Gabrielle Etzel, the healthcare policy reporter at the Washington Examiner, has been watching the Make America Healthy Again movement unfold under this new administration. Part of that includes RFK Jr.'s remaking of the vaccine board at the Department of Health and Human Services. For more, we turn to Gabrielle. Welcome to the show, Gabrielle. Thank you so much for joining us.
Thanks so much for having me on the program.
So your reporting highlights the rather dramatic move by Secretary Kennedy to dismiss all members of the Advisory Committee on Immunization Practices, also known as ACIP. What was your initial reaction when you heard about this?
I wasn't entirely surprised when I heard that this was going to happen. I was surprised with just the speed at which it happened. We found out on Monday that Secretary Kennedy was going to fire the 17 members of the ACIP, the eight or ACIP. It was Wednesday when he appointed the 8 new members, and all of this was also done via social media, done on X. So it wasn't really a surprise move considering his anti-vaccine rhetoric and history of advocacy. This is something that experts were concerned about before his confirmation once he was nominated for the position officially. But it's the speed at which everything happened that's what took me by surprise.
And Secretary Kennedy cited concerns about conflicts of interest as a primary reason for the firings. Your reporting uncovered specific financial ties between former ACIP members and pharmaceutical companies. Can you walk us through some of the key findings and how you went about verifying that information?
Absolutely. Most of this information, all of this information was public record on the HHS website under the Centers for Medicaid and Medicare Services. What I was able to find is that between all 17 members of the original ACIP board, there was about $200,000 worth of money from pharmaceutical companies going to about half of the members of that board. Now, you have to keep in mind that the prior members of the board were a highly specialized group in vaccine science, in epidemiology, and things of that nature. And so, of course, it's logical for them to have worked with pharmaceutical companies, worked for pharmaceutical companies. And so that's where most of those those financial connections came from.
Interesting. And the medical community seems largely critical of Secretary Kennedy's actions. What are their main concerns about the new direction of the ACIP?
The American Medical Association on Tuesday during its annual meeting, it issued an emergency declaration asking for Senator Bill Cassidy, chairman of the Senate Health Committee, to investigate Secretary Kennedy's decision to disband ACIP. The medical community is very concerned that the members of the board aren't specialists in vaccine science. There's an OBGYN on the board. There are several other there's a pediatrician, several other specialties, but there's very few representatives of vaccine science and epidemiology. There are 2 individuals who have specialized in that field. Dr. Robert Malone, he's the face of the anti-mRNA vaccine movement. And then there's another individual, Vicki Pebsworth, who is not a physician. She has her doctorate in nursing, but she's affiliated with the National Vaccine Information Center, which advocates for patients who've been harmed by vaccines. And it has connections to the debunked theory that vaccines are linked somehow to autism. So those 2 vaccine experts are the primary voices on this vaccine safety panel about vaccine science. So in other words, that's the largest concern from the medical community about this.
And Secretary Kennedy has appointed some individuals with known skepticism towards vaccine, to the ACIP. So what kind of impact could this have on public trust in vaccine recommendations?
From the experts that I've talked to, this could be a double-edged sword. It could have some significant pros and significant cons. Let's starting with the cons. If we appoint vaccine skeptics to this board, or even as some call it, vaccine cynicism, where we're just totally against vaccines and not open to learning about new science or actually letting the chips fall where they may. If we let vaccine cynics on this board, what we could see is a rise in vaccine skepticism and vaccine hesitancy among the lay population. If the primary one of the primary vaccine safety boards is saying that vaccines aren't safe, that's going to lend a lot of weight with people. But at the same time, vaccine skeptics on the board could have a boon for vaccine confidence. Some of the experts that I spoke with, including Michael Cannon, Director of Health Policy at the Cato Institute, and several others, suggest that having a viewpoint diversity on the ACIP board could be actually a beneficial thing. It could provide more credence to the board's findings with respect to vaccine safety. Having a vaccine skeptic or even a hardcore anti-vaccine advocate could lend more credibility to the board saying that certain vaccines are safe, more credit than someone who's seen as being in the pocket of the pharmaceutical industry.
Yeah, it seems like there's very strong opinions on both sides, and you're not really getting a lot of, the in between. I've heard some parents say that, they just don't want their kids to have all the vaccines, at the given dosage that it's being recommended. So it's hard to find something in the middle. It just seems right now there's so much on, either opposing side. The appointment of doctors Robert Malone and Vicki Pebsworth, like you mentioned, has been very, controversial. So what is their background and why have they been considered such polarizing figures?
Well, Dr. Robert Malone is most known for his early work in mRNA vaccine technology. He was one of the pioneers developing mRNA vaccines. But since the use of mRNA vaccines for the COVID virus, he has become the face of the anti-mRNA vaccine movement. He's suggested that this technology isn't ready, it's potentially harmful, and he's very, very concerned about that. At the same time, Vicki Pebsworth, again, not a physician, a doctorate of nursing, is affiliated with the National Vaccine Information Center, and that organization has ties to not only the theory that vaccines cause autism, it also has its founding members were against other vaccine. The vaccine that's most associated with that false connection with autism is the measles vaccine. But the organization that Pebsworth helps lead is affiliated with other distrust against other vaccines, and its founders thought that their children specifically were harmed by certain vaccines. So there's a long history of anti-vaccine injuries with the organization that Pebsworth leads. So again, like you said, it's a very tenuous situation. It's a very hard divisions there, but it definitely has people concerned.
And this situation seems to be playing out along political lines, like very polarizing, like you mentioned. How have you observed a shift in trust towards public health agencies among different political groups since Secretary Kennedy took office?
That's a great question, Natasha, and it's really interesting. There's some new data that came out from the the health policy think tank KFF on this question recently, and found that Republican trust in public health agencies has actually increased significantly since Secretary Kennedy took office. Now, you have to keep in mind that this falls into the context of the post-COVID world where Republicans are the ones who are mainly struggling with vaccine hesitancy, vaccine skepticism, and vaccine that more hardline anti-vaccine stance among a select few. But Republican trust has been bolstered since Secretary Kennedy took office. Trust in the CDC among Republicans has increased by 11% from 2023 to 2025. That's now roughly half of Republicans say that they trust the CDC's recommendations on vaccines. And similarly for the Food and Drug Administration, the FDA, that's up 10% during that same 2023 to 2025 time period. So again, roughly half of Republicans. Now, Democrats, on the other hand, have lost significant trust in the public health agencies, but they're still higher overall than Republicans. Trust among Democrats for both the CDC and the FDA fell by about 10% over the past 2 years. So roughly 70% of Democrats say they'll support those public health institutions.
Interesting. And your reporting indicates that Senator Cassidy was given assurances by Secretary Kennedy before his confirmation. What was that promise, and how does the situation potentially affect Senator Cassidy politically?
That's again a great question. So before Secretary Kennedy was confirmed, Senator Bill Cassidy from Louisiana was a key vote to get him across that finish line. He is a leading health voice in the Senate. Again, the chairperson of the Senate Help Committee, the Health, Education, Labor, and Pensions Committee. And he was a pivotal support for moderate Republicans in getting Kennedy confirmed. Cassidy has been a strong advocate of vaccines and pushed Kennedy very hard in his two confirmation hearings before being confirmed by the Senate. For a long time, it was a wild card as to whether or not Senator Cassidy was going to support Secretary Kennedy's confirmation. But in a surprise vote, Cassidy did support Secretary Kennedy, and Senator Cassidy went to the Senate floor, saying that he's spoken with Vice President Vance and with Secretary Kennedy, and he listed all of these promises, including that Secretary Kennedy wasn't going to mess with the vaccine safety system without talking with Senator Cassidy and getting a wide range of perspectives. Fast forward several months after Secretary Kennedy is confirmed officially, and all of this news regarding ACIP happens, and we have a tweet from Senator Cassidy saying that he's alluding to the fact that he is also concerned about the newly appointed ACIP members, and that he's been in communication with Secretary Kennedy since then. Now, in my conversations with Senator Cassidy's office, it does seem like there is an open line of communication between Secretary Kennedy and Senator Cassidy. The connection seems very strong, so we'll see what happens going forward. But we also have to keep in mind Senator Cassidy is up for re-election in the very red state of Louisiana, and Cassidy was one of the handful of senators who voted to impeach President Donald Trump during his first term after the January 6th incident. So there's a lot of complicated politics here, as well as public health concerns.
Very, very interesting. And you mentioned an emergency resolution passed by the American Medical Association calling for a Senate investigation. What are the chances of such an investigation happening, and what could it possibly uncover?
That's a great question, and I'm not entirely sure. I think that the call from the American Medical Association to investigate was strengthened actually on Tuesday. My colleague Elaine Malone reported that Senator Bernie Sanders, the ranking Democrat on the Senate Health Committee, was also calling on Senator Cassidy to launch an investigation into Secretary Kennedy's behavior. So we'll see if that comes to fruition. It's still up in the air, but it's definitely possible.
Can you explain the gold standard science concept and how it relates to the Trump administration's approach to vaccine policy?
Of course. Now, and it's definitely easy to see where that gold standard science language is applicable here. But the phrase gold standard science has been a tagline of the Make America Healthy Again movement of Secretary Kennedy for a long time at this point, since he was nominated back in November. And most importantly, just the phrase in general means bringing back trust and credibility in those public health institutions. Now, that's in and of itself is a bit loaded, but in this context, we have to keep in mind the damage that the public health institutions received to their reputation during the COVID pandemic, and so particularly with respect to COVID-19 vaccines. And so with vaccines in general, vaccine policy in general, that gold standard science refers to placebo-controlled trials, mostly, like you mentioned earlier, with the number of vaccines that are given in the childhood vaccine schedule, so given to infants. There's a lot of concern among parents that it's not individual vaccines that are the problem, but the amount of vaccines given at one particular time. And so what gold standard science means in this context is testing each individual vaccine against a placebo saline solution, essentially, and testing long-term side effects. It's difficult to discern what is true and what's not with respect to some of these very nuanced and in-depth concepts coming out of HHS with respect to clinical trials. It's something that's in some respects above my pay grade, and I've had difficulty asking people and getting vaccine experts to even talk with me. People are very afraid of what's going on right now.
Yeah, incredible. And so, yeah, I mean, how difficult was it to get people on the record to talk about this issue, given its sensitive nature? Did you encounter any roadblocks like the one you just mentioned? Any others or other challenges in your reporting?
It's been very difficult to talk with physicians, quite frankly. That is something that's been characteristic of my entire time in healthcare journalism. That getting a physician on the record who isn't necessarily affiliated with a particular advocacy group or organization that will have their back. The doctors, and I also have medical professionals in my family. Doctors and medical professionals are frightened to talk and share their professional opinions for a host of reasons. But medicine has just become so politicized, and especially with respect to vaccines, it is very difficult to get people to open up and share their perspectives on the record. But at the same time, it's also difficult to talk with the administration, quite frankly. I mean, it's the administration is still getting its footing with respect to their press teams, but it's also difficult to get through the bureaucracy barrier, as I like to call it. Sometimes it's difficult to be able to learn what's actually going on the inside on the ground.
Interesting, because I mean, we keep hearing how transparent things are, but I think you're probably the first person to tell me that it's not exactly as transparent as they say.
It's not always as transparent as they say. I don't think it's sometimes, especially when we're dealing with things that are often in flux. The whole of HHS is very much in flux right now. With respect to, again, developing their press teams and getting their ideas off the ground as well. We're still waiting for a an official CDC director. We've just now implemented a deputy HHS secretary. So there's still a lot of ground to cover, and it's still a very new administration administration. So we'll see. Hopefully things will change soon.
What are you watching for in the coming weeks and months regarding this story? What are the key developments that viewers should be aware of?
There is always so much moving in the healthcare news space. It's difficult to keep your head around. So I think the most important things to be watching for is whether or not Secretary Kennedy will appoint any other members. He only appointed 8 this week, excuse me, he only appointed 8 last week, but it's still very possible that he could appoint more members to the board. The number isn't necessarily set in stone statute. So it's also important to see what this new board decides to do. They have a meeting scheduled for June 25th, so we could see some action come out of that. It's also, again, up in the air whether or not Senator Cassidy will get involved here more so than he already finds himself, and whether or not he will launch the investigation that the AMA and Senator Sanders are requesting. So there's, again, a lot to see.
A lot of moving parts, and I know there's even some lawsuits being thrown at RFK Jr. So, I mean, who knows?
Yes.
A lot for you to report on. Never a boring day, I'm sure.
Never a boring day, Natasha. It's always fun.
Thank you so much for sharing your insights with us today, and it's been fascinating and informative coverage. Thank you so much.
Thank you so much for having me on.
Well, thank you so much for watching Deep Dive. Please visit our website for more of these investigations, and feel free to send us your questions or story ideas, and we hope to see you back here next week.